This is Ethan Moore. I'm going to be demonstrating my bed to chair to bed transfer recheck technique. This is our first recheck. So before you start, you would want to walk in, perform hand hygiene, apply clean gloves, look at the patient's armband and identify them by two identifiers, their name and their date of birth. You want to check their level of cognition, be sure that they understood what you were saying, and then explain the procedure to the patient and all the steps that you needed to take during transfer. So as they were supine, you would be sure that the chair is at a 45-degree angle to the bed, and then you would raise the head of the bed to a 30-degree angle and be sure that it was lowered. So then you would assist the patient onto their side, facing you, and you would have your knees flexed and your back straight. You would place the foot closer to the head of the bed in front of your back leg so you could pivot on it, keeping your knees flexed and your back straight. And you would need to be sure that the bed is in the low position, but that is at your waist level. And so you would place your arm under the patient's shoulder, the arm closest to the head of the bed under the patient's shoulder, supporting their head and neck, and your other arm behind their knees. And on the count of 3, you would rock them to an upright position. So 1, 2, 3. Swing their legs over the edge of the bed and be sure that they dangle there for a second to rule out any dizziness or orthostatic hypotension. And before you start the transfer, you need to be sure that the patient had on skid-proof socks or shoes. So then you would apply the gait belt in a low position around the patient's waist and be sure that it's snug but not too snug to obstruct breathing. So you would again keep your knees flexed and your back straight. You would grasp the gait belt palms up at the patient's sides, and on the count of 3, as your knees were aligned with the patient's knees, on the count of 3 you would rock the patient to a standing position. So 1, 2, 3. And then you'd pivot on your back leg. You would gently lower the patient into the bed, instructing them to use the armrest to ease themselves into the chair, keeping your knees flexed and your back straight. And then you could remove the gait belt. And then you want to check the patient's seating position. Be sure that the head and neck were erect and straight, and that their spine was straight, that their arms are supported on the armrest, that their weight is evenly distributed over their buttocks and their thighs, and that there's a gap between the back of the patient's knees and the chair, that their ankles were comfortably flexed and supported on the floor. If they were too short, you would need to get them a stool or something like that to prop their feet on. And then be sure that the patient had anything they needed beside them, like especially the call bell. Always be sure that's beside them, or if they needed like a glass of water, anything like that. And then when you would go to transfer them back to the bed, you would again apply the gait belt in a low position. Be sure that it's not too snug and would obstruct breathing. So you'd keep your knees flexed and your back straight, align your knees with the patient's knees. Grasp the gait belt palms up at the patient's sides. And then on the count of 3, rock to a standing position. So 1, 2, and 3. So you would again keep your knees flexed and your back straight. Pivot the patient on your back leg. And then you would instruct the patient to use their arms to gently guide themselves down onto the mattress. Okay. And then you could remove the gait belt while they're still sitting up. Then again, with your knees flexed, your back straight, you would instruct the patient that you're going to pivot them. You're going to swing their legs up onto the bed. So your hand closest to their head of the bed, you place on their shoulder, and your other arm on the back of their knees. On the count of 3, you're going to swing them up. So 1, 2, 3. They would still be in the side lying position, and then you would assist them into the supine position or a comfortable position for them. You would cover them up and be sure that they were in a comfortable position and that the call light was beside them. And then you would always be sure to raise the side rail back up to protect the patient. And then you would lower the bed back down to a comfortable position for them.